Okay, so it looks like we need to get started and we'll have the attendees join in as we go. We'll try to make this session as interactive as possible so that if you have any questions during this first initial part of the session, please go ahead to the question section on your panel and one of our co-presenters will actually try to answer them over time, or I will take them over towards the end of the call. As we all know, right now, telehealth is one of the topic. Everyone in the rehab space is actually looking for information. Information is so scattered that half of the time we're either looking for whatever the information is either partial or incorrect. So what we want to do here is try to streamline what we know, and then most important is try to focus our attention on the user experience. Try to focus bring our focus to what's the most important is our service. Like imagine insurance payments and many other things are important. But the most important is, can you deliver a good treatment to your patient through the technology you're using? And that's where most of the clinics and the practitioners are actually leaving behind. The important thing is, are they doing a video conferencing or they're actually doing a tele-rehab session? And this is what we will be actually focusing in next hour today. We'll probably be presenting for 45 minutes, and towards the end, we'll try to talk over any questions coming through. And I hope you'll have a great time and learn the impact of the video conferencing and telehealth softwares on the patient care you are delivering. My name is Dr. Ashok Gupta. I'm a physical therapist. I have a doctorate in physical therapy. I also work as the Chief Operating Officer at TheraNow.com. TheraNow.com is one of the leading telehealth practice software. I do want to have a disclosure that the telehealth, TheraNow has its own telehealth software specifically built for telerehab, and you will see some of the content provided by the company. So before we get into telerehab, I would like to bring your focus on what's the difference between telemedicine and telerehab? Is it two different professionals just doing the same thing? Or do we need something different? Or do we need more than actually a basic technology? So for example, I'll give you telemedicine. There are American Well, Doctors on Demand. They have been out there for decades now. And then now we see that how amazing the whole software and apps and then the direct patient access has become through those amazing companies. But if you see the core technology, it's about a reliable video conferencing built with the doctor's license in the state where the patients are. And third thing, and most important, is being able to write a script for their medication, which patients can actually choose to go and pick it up from their nearby pharmacy, like Walgreens or any similar pharmacy, as easy as it's possible. And the quick assessment when we talk about, just a second, it looks like my presentation is not in screen mode, so I'm going to go ahead and actually do that. Okay. So sorry about that. Looks like this would be a better view. So the most important is writing the script and then having the patients to go and pick up the medication. Assessment focuses on actually talking to the patient, interviewing them, and finding the actually symptoms and signs so that the doctor can lead to one of the diagnoses. There's not much of objective and assessment portion related where you need to do the movement assessment or actually work on the education part of it. When it comes to rehab, I believe personally myself, 50% of what we do is all about education. And then patient being able to absorb that content, absorb that information, and then be able to use it in the rehabilitation. And that's what we are offering here. When you do telerehab, you need the tools more than video conferencing. That's what my personal belief is, but we're going to find that out. Is this exactly the same telerehab or versus any simple video call? So when we go here, telemedicine versus telerehab, telemedicine is all about video call one-on-one. and having to do a basic assessment and be able to e-prescribe the medication. There are a ton of softwares for that. The doctors have access to like eScript, scripts, and things like that. And then the patients have an amazing experience doing that. It works the perfect. When we come to telerehab, let's take a focus on what all extra things you might be needing. For example, here, obviously, the root of the telehealth and telerehab softwares is based on the one-on-one video session. And that's what obviously any of the telehealth has to have. So the video conferencing has to be built in, it has to be live. But there are some options as well where you can do asynchronous telehealth, and that not require you to have one-on-one video call. You can actually have like a chat built into with your patients so that they can communicate, or it could be store and forward. So you're not having a live one-on-one communication, but that's like a totally different format. Today, it looks like we all are focusing on one-on-one video sessions with the technology advancing so fast. That's the prime target is. And then obviously the outcomes are better this way as well. When we talk about telehealth in physical therapy or occupational therapy, it's very important that when we assess our patients and during the assessment, we should be able to do movement assessments. Reason we are, and especially I'm going to speak on behalf of physical therapy right now. In all 50 states, there is some form of direct access. Patients are going to reach you in your region to achieve to avail your services, and when this happens, they may or may not have enough content, enough history and physical or documentation or prescription with them. Now it comes to you as a direct professional to assess the patient, come to a provisional diagnosis, and then based on that, start your treatment, start your care, and if needed, refer the patient out to the specialist. If needed, refer the patient to one of the physicians. But most of the time, if you can deal with the situation, if it's within the scope of your practice, you would want to go ahead and treat them. That is when the comes in the picture is differential diagnosis. Patient never comes to a therapist saying, I have a bicipital tendonitis. They usually come to a therapist saying in the direct access that I have a shoulder pain. Now it's on me as a therapist to be able to take their history, subjective, objective, and assessment information, be able to differentially diagnose, and then lead to one of the diagnosis which I believe is most accurate. Without, and if I can't achieve that goal, then I may have to refer the patient. But let's say for this case, if we have tools built into our system, we can actually use them. But what about the video conferencing? I would say if in a video conferencing, the only way I can actually have my patient follow instructions and do things is that I need to step back, either have a couch behind me or the treatment table, lay down on it, make movements, expect the patient to understand them, and then follow them. And that's what I would do. Can you imagine like how that session could look like? Like for every single movement, like empty can test or ear gaston test or speed test, any of those similar movements I want my patient to perform, every single time I have to adjust my camera, move back, perform those movements, and ask the patient to repeat it. So probably, I guess 30 minutes will be all about this, moving around the whole setup. But if it's a telehealth, a telerehab software, probably you should have all these features built into it. And if it's a real telerehab software, it should have it already in there. And then you don't even have to get up. The software I use, in my 30-minute session, generally I don't even stand from, or I don't even get up from my chair. I just sit and then perform my whole session right from there. So that being said, it's more about online assessments. What about once you have achieved the diagnosis? You know what it is. How do you treat them? I'm going to compare here ourselves from the rehab professionals to the psychology services, or even what we just talked about, telemedicine by physicians. So the outcome is the treatment. We want to provide the treatment. So when the physician is providing a treatment, it's by the medication. So they go to the software and then write the script, and then their treatment works best because that's what the patient was looking for probably. The psychology counseling or psychiatrist they're probably looking for the information. They want to have a counseling session. I don't think there is any problem if you're talking one-on-one, as far as they can hear you, they can see you, they could be in the same room, or they could be sitting 100 miles apart. That's totally fine. It works the best. The results are amazing. Telehealth and mental health has been really at the forefront of telehealth for like last decade now, I would say. Uh, Now, when we come to tele-rehab, how do we treat? We treat by the means of exercises and modalities. Sometimes the modalities are portable and then can be brought into the patient's home, and then, or maybe patient can invest in those modalities and then use them on their own. But they still do need a right dosage and parameters, and that's where the therapist can actually pitch in and then have them perform those modality treatments at their house by themselves, but with your supervision on it. I can give an example of TENS machine. I have a lot of my patients personally use TENS machine off the shelf from Amazon. And what I personally do is, as a therapist, I prescribe them the right dosage. I show them how to apply the TENS machine on themselves so that they're not doing it wrong, and then the results are maximized that way. So what other way we treat patients is, I would say majority of my treatment is through exercises. It could be passive, it could be manual, or it could be self-active range of motion or strengthening exercise. I would say 80% of the treatment usually is active or active assisted range of motion exercises, and that means it's the patient doing it under my supervision. Can I deliver the same thing in telehealth where we have 100-mile distance and I'm not in the same room? But at the end of the day, the same treatment has to be done by the subject itself, or the patient itself. So that is where, if you have the right tools, you can explain them what the exercise is about. That is the most important requirement for me to use any tele-rehab software, that it should have an inbuilt ability to being able to assess, and after that being able to treat my patient. And treat means it's about exercises. So it should have an option where you'll be able to pull up the programs, create a custom program for your patient, telecast that program during the session with your patient, and explain them in this exercise. So like, imagine as get your therapist hat back on, and then think about someone you want to work on a quadricep strength. What is happening here? I want to work on this muscle, and I bet, unless it's contraindicated for other means, there has to be a partial squat or squat built into these programs. And then when I'm doing that, most common problem with any random patient is they will try to do drop down with a lot of knee flexion, and then their weight bearing or their posterior chain squat is all everywhere. They are not able to follow the form. That's where the therapist comes in picture. They know what the target muscle is, what the right way of doing that exercise is. And that's when what I do in personally my clinics, when I'm doing a one-on-one, I jump on and then explain them by showing them how this exercise needs to be done. Then I have the patient repeat it. The only difference in telehealth is my software should let me do that. What I need to have is the software should have the pre-recorded videos of the exercise in the right form. I can use that video and be able to explain my patient, this is the exercise, these are the things you must do, and these are the things you actually need to avoid. Let's do it together now. So I explained to you, now you do it, and let me see it, and I'll review it for you if there is any problem. So things like these are very, very important. And I'm going to point on to one more very, very important factor in tele-rehab or telehealth, or in general in physical or occupational therapy as well, is being able to track the progress of the patient. So what happens is, like, I can track and document that my patient did 20 repetitions or 30 repetitions, and then be able to document that. I'm sorry, it's work from home. So yes, being able to document that when my patient is right in front of me, that's what I do, and then be able to track their progress. What if the patient goes home? 2 days they're coming to the clinic. What about the other days? I don't know. The only thing I do is the next time when they can come to the clinic, I take their feedback, I reassess them and document it again. here in telehealth, most of the time patient is home. So we need to have a technology which can track the patient's usage, their compliance level, be able to report it back to you so that next session, you are able to use that information and create your session more effective. At this time, let's just do one of the polls I have built here. And what I would like to do is like take your feedback into the system where I have a very simple question for y'all. Okay, so here's my question for everybody. And if you are using telehealth already, which by this point of time, I believe some form of you might have been using it. And so I'm going to have this question on your screen. I would appreciate if you can actually go ahead and answer whatever the answer best fits your condition right now. I'm going to wait for just a little bit before all the answers come in. All right, looks like we're getting results out here already. I'm gonna wait just next few more seconds and then we'll close the polls. If you haven't already answered, please go ahead and do that. All right, looks like we have most of the answers here. I'm gonna go ahead and close it and we'll be able to see what the results look like. All right, here we go. I believe you are able to see the results. Looks like audience right now is using 80% of the specialized telehealth platform, or they are interested in one. So that's the very good news here we have, that all of us are cognizant of the fact that in the rehab space, it's important that we take care of, we have some system built in where we don't have to stand up all the time. We don't have to just like go by what patient says is a shoulder pain and then give them a very random exercise program, sticking like 10 exercises and expecting at least one or two will work. We should actually have the same custom experience what we give them over in our clinics when we diagnose them, assess them, reassess them, and then make a custom program. That's what the same experience we want to give to our patients, whether or not if you're using the conventional mode or telehealth. So these are the checkpoints. We always want to make sure any software you're using, you must have the video conferencing live one-on-one. Reliability is the prime key here. There are simple options, but then the bandwidth, internet, those are the things you want to watch out for. The second thing is online assessments. I'm not sure which mode or form different softwares are, but I'm going to give you a little insight on how these online assessments are performed and then how best you can use them to make your telehealth session more productive. All right. Let's take a little look here. This is one of the content provided by the TheraNow, and obviously, as you can see, there are basic features built in, and any software we're using should have the prime thing I will always focus is do not use something which is limited to one or two form of technology. That being said, if it only works on computers, only works on apps, especially in the rehab space, we get patients ranging from kids and peds actually, all the way up to 60, 70 years old. Sometimes there are caregivers helping them use the technology, sometimes they are not. Having a technology, let's say, for example, I'm going to use this example right now, GoToWebinar or Zoom. And all of these require you to send the links out, send the codes out. I'm not a biggest fan of them. I am personally myself not. If there's somebody who needs to come and visit the portal at least like more than one time, they shouldn't be actually getting the email links. They shouldn't be getting the codes, anything like that. What they should have is a place where they can go put their username and password, and then be able to actually do every single thing repeatedly. And as let me put your focus back on therapy again here. In therapy, what happens is we don't have one session like most of the physician sessions are. Our sessions are based on multiple episodes. Our sessions are built on ability to evaluate, follow up, maybe recertify, and then actually follow up and discharge. So the whole program should be able to perform things like this. That's the most important thing is if you're a multi-specialty clinic, if you're an organization who has more than one services, like for example, I've seen a lot of multi-specialty clinics where there are chiropractors, there are physiatrists and the PTs and OTs. Your patient shouldn't be actually having a different links or accounts or things to work with them. They should have a simple, straightforward one place where they log in and then be able to have the first session with the PT, the second session with like an online school. Imagine you got into your account and then you have a session 1, session 2, the math, and then English. That's how the experience that your patient should have. And that's, you may not focus yourself right now because this is not very prevalent, interdisciplinary approach in telehealth. It's not many softwares are offering out there, but I do know that this particular company, and that's why actually I work for them, and at the same time, I've practiced it. I personally use this on my own patients. So this has been the most important thing to look for. Obviously, messaging and asynchronous telehealth is one of the important thing as well. Use ease of access. I cannot focus enough on ease of access. Like for example, I'll give you, there are options like, I hate to put names out there, but yeah, one of the most common, we all know, the software we use in the hospitals. It takes like few days before you get like a little comfortable with being able to do anything on that software. Even there are options like for the patient portals as well. They need a lot of navigation. Your software or telehealth technology you're using should be very straightforward. Should have like everything what normal user would expect, and then all in one place. It shouldn't have a complicated pathways from one place to another. And then it should look almost the same everywhere, whatever piece of technology you're using. So that's one of the most important focus I always talk about, not working with a technology which sends out the codes and the links, because on an average, the rehab patients are on a higher range of age. Personally, the kind of patients I work with, my patients' average age is between 45 to 65. That being said, that age group needs to have, obviously we all grew up with technology. The younger you are, the more savvy you will be with the technology. But like you need to think about your population, the audience you're working with, and then what the ease of access is. So you do want to go back today, whatever software you're using, whatever technology you're using, and you want to revisit that and reassess that, and then put yourself in the shoe of a 70-year-old person who used to have a flip phone a year ago, and now suddenly they have a smartphone, so they can actually use it. But can you use it actually? Is it easy enough? Ease of access is important. Things like that. Important is 3 main pillars of tele-rehab: being able to assess, being able to educate, and being able to treat. All of them should be in one single place. When we talk about any form of telehealth, you start with being able to book visits, you start with being able to scheduling and then collecting the payment if the patients are paying cash. And then after that, being able to conduct the session, during the session and after the session, being able to supply them with the educational material you want them to read or educate themselves on. And most important, the treatment part. Can all this not be done by using 10 different apps or 10 different technologies? Yes. The answer is simple yes. But like then comes the user experience. Then comes the compliance of the patient. Can they go and look at the Outlook calendar where you send them a Zoom link? Yeah, if it's 20-year-old or 30-year-old who uses Outlook for his work every single day, yes, I wouldn't say they'll have any problem. But like any 60-year-old who doesn't have anything to work with Outlook, they will have like a big problem when you're going to send them an invite. So you do need something comprehensive, which keeps track of the appointments and doesn't actually confuses the user. Second thing, when we talk about the payment processing, obviously you can collect PayPal, different credit cards. Most of the clinics already have a credit card machine or ability to, but then it's about using one platform, then the other platform, and having the user to actually navigate between 10 different things. Documentation, most important is treatment. So how well the platform we use has the features related to exercising, that's the important thing is, and the quality of exercises and also is prime importance. So like for example, let's take a look of a couple of things here. It should have a very clear-cut instructions about what exercise they have. It minimum should have a high definition videos of each exercise, because personally, I'll tell you what I've learned, you can send them a ton of pictures. They don't do the justice. It should, the easiest example is annotations, and then have an ability to actually show the exercise in the real life, a real example. Pre-recorded is fine. You can stand up and do it. That's fine as well. It's just like a lot of work for you that every single time you need to stand up and then explain them this is how you need to do it. But otherwise, it should have a high definition, high quality videos with annotations and instructions built into it. Those are the things of a prime you must look into your software. And then I cannot stress enough that it is the bread and butter of the telehealth, not the session you do with the patient one-on-one. It is because you're gonna only spend 30 minutes, 45 minutes, or an hour with the patient, but like when they are home, the rest of the days, those are the time what they do is going to bring results. And then those are the results we are actually working for. And that's the most important thing as. So here's one of the features I love about the assessment. So I'm going to talk about the assessment here. I'm just going to take now a brief moment to focus and bring your focus when we talk about movement assessment under video conferencing or under any telehealth software. And then these are the areas I would actually like to bring your attention towards. You do want to see it. So I'm going to give you a real life example. A patient has a back pain or shoulder pain, and then they have been explaining you, and this is a part of your assessment, right? You're asking for the pain and they're explaining you it's here in my shoulder area. Now you don't know what exactly this is. Because it could be acromion, it could be humerus, it could be like your supraspinatus over here. And then they're so vague in explaining that it's so hard to actually like pinpoint the pain area. If it is a vague pain, okay, that's fine. But then what about this, not the shoulder? Let me take an example of low back. How do you expect a patient to get up on a video call, being able to show you your low back and then be able to exactly like take their hand all the way down? And you're expecting this from a 60 to 80-year-old person that like he able to pinpoint right properly and then be able to explain you with the camera showing that same area and then you're getting it. The second best option is use technology for that. And what you can do is have the pain locators, which most of the software should already have built into it. Pull that up and then let the patient explain you which or what all are the areas they have the pain in. Obviously, then you can easily navigate that around and be able to document this process. This makes your pain assessment very, very precise and effective. The next time you can come back and reassess on the same model as well. The second area I'm going to actually talk about is a lot of time we do not think about is palpation. So when we're doing an online assessment, I would say 7 out of 10 patients I treat on telehealth personally, I perform self-palpation on them. And now you're going to say what this is actually, what that self-palpation means. It's self-description actually. There is not much to explain about it. The patient does the self-palpation. I went to school for 7 years to learn where the acromion is. And then what we are expecting in 7 minutes for the patient to understand where the acromion is and then be able to palpate it. It will be very hard for sure, but it's not impossible. If you have the right tools, I can actually do it 2 ways on a video conferencing, move back a little bit, and then start actually try to show them that this is where my clavicle is. Try to keep going laterally, and then when you get to the shoulder tip, and then this is where. And then I'm expecting them to be able to see that from the iPhone, the small phone they have. Now put that down and then be able to reproduce the same result for me. If you want to do the self-palpation. probably if you don't have the tools built into your system, what you're going to do is not going to do it, because that's the easiest way to skip this portion and then move on to the next portion of like, let's try to judge based on whatever information we have. So these health patient majorly what they do is any area where the patient cannot reach themselves, obviously those are the restrictions. I'm not saying every single joint, every single structure will be able to self-palpate it. This is the most of the systems I've seen, the good ones with the specific with the telerehab do have it, but a lot of them usually don't. What these have done is there's a specific instruction, highlighted features. This is the actual, this bony prominence. Look at this video, and this is where we're going to start, and then look at this the same way we're going to palpate. Let's watch it together. Not only actually I don't have to move, I take the content built into the system, the telehealth software, and actually show my patient this is where it is. Important part is not actually being able to telecast the video on your computer. The important part is it has all the basic annotations on it to actually get the patient's attention to the specific feature or the area or the landmark you want them to get, and then actually be able to palpate. You would not believe 60 to 80% of the structures which we as a therapist would want to palpate can be converted into the self-palpation mode. And with the right tools, you will be able to use this information into your assessment or reassessments as well. So a lot of time it actually even gets questioned that what if I'm actually doing pre-diagnosed conditions? I don't have to do all this assessment. I would say to any of that therapist is stop, take a little pause, and think when your patient comes to you every single time in the follow-ups, don't we believe that we need to, first thing we do is the reassessment? And then if the reassessment actually calls for being able to palpate and then being able to do the same tests over and over again to show the documented progress on my patient, are you not going to need these same tools at the time as well? So that's there's a self-answered question that as a therapist, we all have to focus on reassessments as well. It's not only the direct access patient. It is not only the patients who are just like coming onto your website or your company's portal and then actually looking for services. We're talking about all your existing patients as well. If you start putting them on a telehealth, if you start putting on everybody in your clinic on partial telehealth, like a couple of visits in your clinic, couple of visits on your telehealth, just to minimize the contact with the exposure with the virus, or maybe afterwards to maximize the potential of the patient's recovery, then you do have to have something where you can reassess and retrain the patient as well. So that being about self-palpation. I'm not sure how many of the softwares and how many of the therapists here are able to actually perform these activities, but if you can't, I do want you to go back and revisit these points and then do something about like where you can start incorporating. These are not impossible, they are possible. They should be done even to make your session very, very effective. I want to come back to the last point, which is the most important, my most favorite one when I talk about the assessments. And I always talk about every single therapist coming to the diagnosis should actually spend a little bit of time and pay attention towards this. That, like, let's say if your patient is with shoulder pain. Now, let's not talk about this. The one I'm going to give you back again, the shoulder example. So in that example, what happens is the patient comes with a shoulder pain. It's a vague pain up here on the shoulder area. If this patient comes to my clinic, the first thing I want to do is differentiate between rotator tear or bicipital tendonitis or supraspinatus tendonitis, things like these. I want to differentiate between them. So how do I do it? Obviously, subjective history, objective history, all of that will help me. But like still, this is an important question to be answered. What is this structure that's causing the pain? What personally I would do is I would do painful arc test. I would do MTCAN test. I would do speed test. I would do your Gaston test. And probably by the time I'm done with this, I will have a result whether it's my bicipital tendon is inflamed or torn, or whether it's my rotator cuff is causing the problem, or it's the other structures. So how do we translate the same level of care on telehealth? That's where some of the unique softwares, and one of them is TheraNow, has done this great work. What they do is they take most of the tests where there's two points important actually. There's a passive resistance provided by the therapist. Can that be used by the contralateral body part? And I'm going to give you an example of a bicep speed test here for bicipital tendonitis. Generally, you go up to 90-degree flexion, and from 90-degree flexion, your therapist actually gives a long lever resistance to reproduce the pain up here in the bicipital tendon area. What we can do is we can translate that into modification by actually using a contralateral body part to do the same activity, keeping your elbow in full extension and then resisting that same shoulder at night. What I have seen personally with my experience, 80% of all those special tests can be modified by self-administered model, by using no help at all or using the contralateral body part to assist you. And that's when most of my patients, like I'll give you the example of one of my patient I was working on the other day, lateral epicondylitis. I performed a modified Mills test. I performed the radial nerve glide, and I performed the Cozen test. Before even I actually started talking about, the reason was he had a pre-existing diagnosis of lateral epicondylitis. But I do want to see whether the nerve passing around is actually the radial nerve is involved as well or not. I do want to know whether like the pain can be reproduced with the test. And I'm actually treating this patient for like what, 4 weeks now? Every single session, I go back in and I perform those tests, and over time what we have seen is the test was positive, 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 negative, like mild, 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 and now we are actually at the level where all of these tests are coming to the negative. Apart from the patient subjective report where the patient is telling me that I'm feeling great. Obviously that makes sense, but patients say great one day, but then the very next day they say, oh wow, my pain is at level 10. So that being said, having these tests done is objectification of their progress. You can actually document and then create your custom tailored program this way. So that's a lot of information. I just spoke about how important it is to have tools to be able to customize your telehealth program. And that's where I summarize my whole point about telemedicine versus telehealth in rehab. And if you're using any specialized tool, it shouldn't be just an exercise builder with an ability to actually do a video conferencing call. If you're using a video conferencing tool, then it shouldn't just be that, and then you're using 10 different apps, because at the end of the day, it's the user experience is going to bring results out. It should have a combination of everything we just talked about, ease of access, ability to movement assessment, the ability to send them an educational material and then track the treatment, the progress, send them the treatment through exercise builders, and have that merged together so that like when you're doing a session, you are not actually getting up from your chair every single minute, adjusting your camera, and then your 30 minutes are actually wasted in all of those things. So now, why now? That's the important question. Everybody is like, why telehealth now? I know TheraNow. I've been working for TheraNow for 3 years now. We have been doing telehealth day in and day out for the last 3 years. We have never had attendance or never had the incoming inflow of inquiries for the software or the services in the last 3 years. But now in the last 1 month, the demand is so high we can't keep up. Why is it happening? We all know it's one answer. It's COVID-19. It has put everything on hold. Traffic, our daily lives, everyone is everybody home. Most of the clinics across the country, wherever the pandemic has taken, started out with like 15-20% of a cancellation ratio every single day to now 60-70-80%, and then a lot of them are also shutting the doors down for a while because they can't keep up. I've heard, you can't quote me on it, but I've heard across the nation a lot of layoffs are happening. The therapists are let go in settings, especially like outpatients. Home health is not hit yet, but we are expecting the home health will also get hit in the next few weeks as well in the different areas. And then they will also start looking for the different resorts, as like what we can see, the COVID-19 has brought outpatient services already to telehealth services. whether it's a conferencing, video conferencing, or a telehealth software, doesn't matter, but telehealth isn't being used right now. So at this point in time, if you are all not already using telehealth for your patients, I would suggest start using it. A lot of time, the first question comes is, why should I do it when Medicare doesn't even pay for it? It's our social responsibility. We need to care for our patients. That's most important it is at this point in time. They are needing us. They cannot come to us in our clinics. They will get exposed to the virus. They can get sick. So that doesn't mean that if the Medicare doesn't pay us for that session, that I should not care for my patient. That's the social responsibility we all as a healthcare professional have, and we must do for it. And then this is, again, one more important point I always talk about. Medicare just came back like a few weeks ago and then said, oh, we will allow e-visits, and then there are so many rules and regulation. So many only patients type can actually participate in one of these. Now, these telehealth sessions. So there are two types of therapists and two types of companies and clinics. One who care for the patients, and they say, no matter what, I want to continue the services you're looking for, whether or not I get paid. They're smart, I would say. Not only socially responsible, they're smart. 2 months or 30 days, whatever it is, it's going to take for us to come out of COVID. But what is going to happen? These patients, do you really expect they're going to stick with you when you were not there with them in the time of the need? When today they need you, you are not there for them because you don't get paid for those sessions. Let's assume that you don't get paid for that session. And that's what you're saying, my doors are shut and I can't help you. But then when you open your doors, you expect those patients to come back very next day. I believe that's hard to digest. We may have to revisit that thought. And then we may have to start thinking about the value you will be able to bring in with telehealth at this point of time. Create the connection, maintain the connection with your patients, show them like that you care for them. And then so when this COVID-19 goes off, they pay back with the terms of loyalty. They come back to your services. If and when they need their services more, they will continue with you and not go around somebody else who has helped them in during this crisis. So safeguard your practice. I cannot stress this enough. Safeguard, safeguard, safeguard. Even if your insurances are paying for it, good. Go ahead and accept that payments. If your patient's insurance doesn't cover it, for example, Medicare, you can still do it. I always want to throw out one bone that telehealth is a non-covered service for the OTs and PTs and speech. That means you can charge the patient or you can actually provide the patient services for pro bono as well. So for but in the other cases, like in-home visit, if you want to even provide for free, as you know, that or charge the patient cash from Medicare, you know, we are not allowed to go out of network from Medicare. So that limits us. But again, that's a totally different topic for a different webinar. We're going to focus today here on the telehealth and telehealth related software. I would be open for questions, but I really appreciate your time, everyone who joined in today. I hope it was of some value to your mental thought about telehealth. If you have any questions, feel free to reach out to the team at TheraNow, or feel free to reach out to me myself on my direct email, Ashok, ASHOK, @TheraNow.com. Whether or not you're using any other type of software, it doesn't matter. I'm here to help you with telehealth, any part of assessments you need. We do a lot of telehealth related trainings as well. There are a lot of information as a therapist, even if it's 10, 15, 20 years of clinical experience you may have, but we need to translate that information into more regular telehealth related actual cases and scenarios. I would be more than happy to help you out that way. Feel free to email me if you need any information about TheraNow software, because most of the features I talked about here are available in TheraNow software. Also, I would want to point out one point is if you would go to software.theranow.com, I do know that software is offered for free for you all to use at this point of time in the light of COVID-19 pandemic. You can start your own telehealth clinic like in 24 hours and get started with it, use it as much as you have to. But once the COVID-19 is done, you may decide, is it something which you want to keep going and working with your patient? That's just a little bit of a sales pitch. I didn't want it to do, but my company did ask me to, so I had to. But anyways, it is more about telehealth. It is more about the best services for your patients. And I'm open for any questions if you may have. Otherwise, thank you for joining here today. We will bring a lot more of different sessions like this based on telehealth and related sessions. Probably we will be talking about the real life examples in the next webinar. I think we will be working on lateral epicondylitis and shoulder on telerehab. So we'll be very, very clinical oriented next time. This time we wanted to differentiate technology. We will have the series ongoing now on, and so keep yourself tuned in. Now register for the email notifications on TheraNow.com so that we can keep you updated on all these sessions. Best part is these sessions are always free. We'll make sure that we pass on the right information to you all. Thank you again. Thanks a lot for joining on this Saturday today, and have a great weekend. Stay safe. I'm open for questions if there are any. They're here. Is the platform available on the web or app? So yes, this platform is available web app, and this is one of the points I did focus on during this presentation, that you need to make sure that platform you're using should be available across the technology, whether it's a tablet, the smartphone, or the video calls like by the computer. It must have all of those availability and access points. If it is not, you will get started, and in the very next few days, you're going to realize you are actually missing out on a lot of users because they do not either have computers in their home or they do not have the mobile phones compatible to the technology you're using. So this is the very first thing you do want to check out with any type of software platform you're using or technology you're using, that is compatible with all type of. So for example, you're using FaceTime. What about the Android users? How are you going to work with them? I hope this helps. Yep. I see here another question is saying, what are the prices on the softwares which has capabilities like these on an average? So this is the most important part. This is where you as a therapist or as a clinic owner, as a company, need to decide whether you want to just like do something with where you're just showing your face, which we just saw that. You may start with Zoom at $16 or $17, I believe, which is not a HIPAA compliant. I think one of the most important piece I forgot to talk about, whether or not the COVID-19 has given some relaxed rules, but HIPAA is still our obligation. It's a PHI we treat with. We are skilled professionals, and we need to make sure that these services has to be done in a HIPAA compliant platform. So you need to see and make sure that the platform you're using is HIPAA compliant. Then second and most important thing is, if it's $16 worth, it will provide you services $16 worth. If you're looking at the clinic model, a virtual clinic, you might be actually looking at spending anywhere between $99 to $100 or $150 a month for a good software with basic technologies built in for assessment, treatment. So you might want to focus at the pricing. It's all about how much you want to spend and what kind of user experience you want to give to your patients. Are there any specific permissions required to treat patients via telehealth? Very good question, actually, here. So when it comes to rules and regulations, it can be like a whole webinar, an hour long, actually, we can talk about it. But in a nutshell, I would say all 50 states at this point in time do allow you to practice telehealth. No one stops you. There are states, they do not have a written law about telehealth, but they do not stop you from practicing telehealth. Most important thing what you want to focus on is always make sure the states you are licensed in, the patient should be a resident of those states. Important catch here. You may have a license in 10 different states. Does that require you to be on the same, within the borders of that specific state? The answer is no, except for one state, and that is Alaska. In Alaska, there is a telehealth regulation, and it requires you to be within the boundaries of the state of Texas, Alaska, while providing the services. So that is one exclusion. Apart from that, you could be in anywhere in the country or any part of the world and then still be able to treat. But the most important thing is, if you have a license in New York, the resident should be from New York. Whether or not you live in Texas, that's okay. So that's a food for thought. You can actually take a look at. And by the way, if it surprises you, I have 17 different licenses, and that's how I keep actually myself super busy on telehealth. I do not treat regular patients anymore. I'm 100% telehealth therapist, and more licenses actually allows me to work around different geographical time zones. And that brings me with another problem, which I would say 50% of attendees wouldn't actually come across, because probably they have a 1 or 2 license. And that is where the state they live in, and that is where they actually provide services. You don't have to worry about all this. But if you are somebody with multiple licenses and you want to actually have your services across multiple states, multiple time zones, you do want to make sure your software is capable of actually making your life easy, not difficult. So, and that's another unique feature TheraNow has, that it takes in, and then as you travel across the state lines, automatically it changes your booking time into the local time. So that's another best feature. Like, for example, you sent the 5 o'clock Zoom link to a patient, and then when the day you were doing it, the patient was in New York, but the next day he flew over to California. That 5 o'clock visit was supposed to be actually happening at 2 o'clock. Both of you missed it. So having a software being able to translate that. So with TheraNow, what happens is, you move all the way to California, you open your app or computer, and you will see your booking will be 2 o'clock instead of 5 o'clock. So let the system and technology help you out so that you don't have to mess up with that. There's another question here. How do I decide which is the best software out of the ones available in the market? How do we evaluate? I guess everything we talked in the last 54 minutes was the information needed actually when you're considering a different technology, whether it's a Skype, FaceTime, Zoom, or anything related to video conferencing, or any other softwares on the market which allows you to do some exercise builder with the telehealth call versus scheduling options with built-in video calling. There are always, you're going to find options where like 2 or 3 things are covered when one, or 2 or 3 things are covered in another one. Most of the time you're going to come across the softwares or platforms, they were not built for what they are saying they're doing right now. They were not built for rehab, and then now they're trying to cater the rehab. And obviously you can expect that lack of attention towards the rehab field in those softwares or technologies. Or if there is where the software is built for just like doing HEPs, and now they have started adding a telehealth calls in it, you will start realizing they are not made to make your life easy by practice management, being able to document in there, being able to perform the online assessments. You will lack, if it's a EMR allowing you to do just a telehealth call, you will realize again the same features will be a problem, that you will have ability to document, you will have ability to build internally within the same system and then talk to the patient. But what about the real telehealth session we just talked about the last hour? So those are the important things and food for thought you might want to think about. Reevaluate the system you're using, try to modify it in such a way that you can incorporate all the movement assessment, education, and the treatments, or try to switch over to something which works the best in your daily scenario. All right, I guess this brings us to the end of our session today. I really appreciate all of you and all your time, and we'll see you in the next session very soon. As far as I know, the next we will be talking about clinical assessment, management, and treatment through telerehab on elbow lateral epicondylitis. We'll take that one unique area, and then we'll take the whole session, and probably we're going to have a dummy patient or a live patient come on and join, and so that you can see and experience how that real telehealth session looks like versus a normal regular video call we are trying to call telehealth today. Thank you again for your time. Have a blessed day and have a great weekend.